Welcome to Delta Wings Aviation Academy, where we prepare you for takeoff.
Hello, pilots. Welcome to Delta Wing Aviation Academy, where we prepare you for takeoff. Today we will be discussing what is spin and how to recover from spin. Fasten your seatbelts as we prepare for takeoff and get a bird's eye view of the details from the sky. Let's start. By definition, a spin is an aggravated stall that results in auto-rotation that may develop into something that looks like this. When viewed from above, the airplane has a high rate of rotation, about a vertical spin axis. Every spin starts with a stall. Every airplane will enter a stall when its angle of attack is increased beyond the critical angle of attack. At the critical angle of attack, the boundary layer of airflow separates from the wings, causing a loss of lift and more drag. It's important to note that both wings are stalled in a spin, but one wing is stalled more deeply than the other wing. In this example, it's the right wing. The cause of an accidental spin may be attributed to exceeding the critical angle of attack while performing an uncoordinated maneuver. This can happen with either too much or not enough rudder input for the amount of aileron deflection applied, or it can happen due to cross control. The right wing stalls before the left, and a violent wing drop occurs. The right wing that drops has the relative airflow inclined upwards, increasing its effective angle of attack and increasing drag. As the airplane rolls, the left rising wing has a reduced effective angle of attack and remains less stalled and has less drag. This situation of unbalanced lift tends to increase as the airplane yaws toward the lower right wing. This causes the auto-rotation. As with any stall, the nose drops and inertia forces take effect. The instinctive reaction by the pilot to stop the wing drop with aileron must be resisted as it stalls the wing even more. If the correct stall recovery is not initiated, the stall will develop into a spin. There are three phases of a spin. Phase 1, the incipient spin. The incipient phase of a spin is the stall and spin entry. A developing spin exists when the angular rotation, airspeed, and vertical descent rate are changing. Phase 2, fully developed. If uncorrected, an incipient spin degrades into a fully developed spin. In a fully developed spin, the airplane settles into a steady rate of rotation with a steady rate of descent at a low airspeed and a high angle of attack. Phase 3, recovery. Recognition is the step towards a correct recovery. The pilot must analyze all the parameters and verify that the airplane is in fact in a spin before any correct recovery action can take place. The spin recovery begins when the anti-spin forces overcome the spin forces. Recovery occurs when the pilot applies rudder and aileron inputs to counter the spin and the airplane regains lift and control function. Once the inputs are initiated to stop the spin, the airplane can usually recover in less than one spin. Recovery from a normal stall is achieved by reducing the angle of attack, which restores the airflow over the wing. In addition to this, spin recovery involves stopping the rotation. The complex aerodynamics of a spin requires different recovery procedures depending on the airplane design. No common spin recovery procedure exists for every airplane. The recommended general recovery procedure is reducing the power to idle and releasing the pressure on the controls. The design of some airplanes is such that recovery from a developed spin requires definite control movements precisely timed to coincide with certain points in the rotation for several turns.